Thank you very much. And this morning we continue our conversations with the candidates. Less than a week to go to Election Day. Can you believe it? When voters will elect a congressman for the 6th Congressional District, the Baton Rouge area. The incumbent, of course, is Republican Bill Cassidy, and he joins us this morning. Great to see you.
Thank you, JP.
Boy, big, exciting time. Election's almost here. How's your campaign going?
Campaign's going well. During the campaign, you get to connect with people. You have time off, if you will, to go visit. Clearly, the issues that concern people are jobs, the economy, and the moratorium. All three are related. And frankly, since I think most folks in this district are on the same page, it's a good time to be talking to them.
Yeah, jobs, and more jobs. Everybody's talking about it. Unemployment rate hovering around 9.6%. Specifically, you know, if you're reelected, what are you going to go to Congress and tell them to do to get that unemployment rate down?
If you look at who's unemployed across the nation, it's typically men without college degrees. We know in this state that if you end this moratorium, which, by the way, the government scientists said a blanket moratorium is not the answer. If you end that moratorium, you create prosperity for families with those jobs on the rigs, on the pipelines, on the barge, on the supply boats. It just ripples across. I just read in the paper today that the oil and gas industry accounts for 12% of the gross domestic product of Gulf Coast states and more for Louisiana, about $28 billion in total. $28 billion is a heck of a lot of jobs. Let's get those folks working, not only for the jobs, but also for our country's energy future.
So when is this going to happen? When do you think we'll get those folks working? I mean, now that the ban has been lifted, but the drilling hasn't restarted up the way we want to see it yet.
The president, the administration has said that the moratorium is over. It's unclear to us as to whether or not that's true. Brownwich made a statement yesterday, the head of their Bureau of Energy Management, that they were not slow walking any moratoriums. My office, though, knows that there are steps before a final approval that they are slow walking. We're trying to get that so we can make it public. So it's anyone's game right now. Clearly, the president's party is making a decision to slow down. Again, despite the fact their own engineers say that that is not indicated, it is not the answer.
Another sticking point concerns tax cuts. Some folks want to extend the Bush tax cuts. The administration, not so sure about that. What do you think?
Keep in mind, when we say the Bush tax cuts, what we really mean in January, one of two things will happen. Your taxes stay the same or your taxes go up. That's what's going to happen. And in a recession, when folks are needing their money to, one, pay their bills, but two, to create jobs if they're a small business owner, I don't think it's the time to raise taxes. The power to tax is the power to destroy. Right now, if we raise taxes, we're going to destroy the ability of job creators to create jobs. I'm in favor of extending them for everybody. Let's get people back to work.
What about health care? I mean, historic health care overhaul plan. There are some in Congress that say if Republicans gain control of the House, and it looks like they will, that they're going to start to reject that and to remove many of the provisions that were passed by the Democratic-controlled Congress.
Well, of course, as you know, I've worked at Earl K. Long, still work at Earl K. Long. Saw patients yesterday morning, so the issue means a heck of a lot to me. If Republicans take back that House, we will attempt to do something significant. The bill that was passed is already increasing cost. It is already disrupting people's health care plans. It is already pushing cost upon small businesses to comply with the regulations, which again is distracting from the ability to create jobs. What Republicans would like to do is replace this kind of top-down bureaucratic approach to health care with a bottom-up approach in which the patient is put in control of her health care dollar. We think we can achieve the same result, but at a lower cost. We'll definitely push for that.
One final question. You want another term? Why should voters here give you another term?
I've had the privilege to represent this district for the last 2 years. We've made it a point, my staff and I, to listen, to understand, to attempt to take the information we've learned and put it into public policy. Hopefully the voters will agree that we've done a good job with that. If so, I'd ask that they would return me.
Well, you're going to have a busy rest of the week as we approach Election Day. Bill Cassidy,
Thank you,
good luck to you in the election.
Thank you very much.
We look forward to working with you.
I appreciate that.
We appreciate that.